Okay, welcome back everyone. I hope I'm clear to everyone. Is my voice clear? All right, so talking about Dr. Pfizer's performance. I really appreciate Dr. Pfizer. Your performance was really up to mark. Okay, I can say that you are really well prepared for this exam and you will be good to go. But there are a few things that we need to discuss and add on to this, and you will definitely learn from this. Okay. So I really appreciate all the points in your history taking. They were really good. You asked me about all of the history of the event. That is the most important thing to ask to find out if that was a domestic cat or a wild cat. Okay. Moreover, yes, one of the important things that you need to know is, although I told you about this myself that it bit me on my hand and it scratched my feet, but you need to ask about the exact location if the patient doesn't tell you, okay? Which hand is it, and what were the symptoms at that time? Was there any bleeding? Was there any swelling immediately after that? Did you have any difficulty in performing any kind of task with that hand? Because hand is an organ we use all the time. So you need to ask if he is having any difficulties in performing the daily activities as well. Okay, because restriction of movement is something we need to rule out the neurological damage that could have caused by that bite. So that is why it is important. Moreover, you mostly asked about all of the symptoms, about bleeding, about swelling, erythema, and pain and discharge, and I really appreciate that. That was really good history. Okay, but since I told you all of the event details in one go, right? I told you everything, what happened, how it happened, and what was I expecting, and I was in shock and everything. And then I told you that I managed it myself, and everything was fine after that. I said that. So you are supposed to ask the patient here that what concerns him now, because if he is well treated, he thinks that he well treated himself, and everything was fine after that. He managed to do the bandage as well, and he's fine with it. Then here is the point where we need to find out what concerns him the most. As I always say, that this exam is all about the patient's concerns and expectation from the doctor. Okay, so here they want you to ask about their concerns. What do they want? Why are they here? You didn't ask me this yourself. That is why I told you later in the conversation that I am here because of my pain. So after getting a brief history of the event and the animal, try to ask that if everything was well managed a day ago, then what brought him here today? What was the reason that he came today? Okay, so that is what I want to add. Okay, moreover, regarding the vaccination status, you did the right thing about asking about the vaccination status. Rubella is not present in the UK and most of the developed countries. So they are really not concerned about the rubella because of the cat bite. Okay, all they are concerned about is the wound won't get infected and the tetanus immunization. These are the two main concerns that need to be addressed in this scenario. And of course, if the patient presents with pain, then definitely that is the first step to treat. So otherwise, the main concern or the main purpose of this scenario actually is that you should be knowing what concerns the patient. Okay. So regarding the tetanus vaccine status, how do you ask about the tetanus vaccine? You need to ask about, are you up to date with your tetanus vaccination? How many tetanus vaccine doses did you get? When was your last tetanus vaccine? Because that is the booster dose that will tell us that do we need to repeat the tetanus vaccine or not. Okay, so that was the part that you missed regarding the tetanus vaccine, and in the consultation I just felt that you were not very clear about the tetanus vaccination. I hope Dr. Faiza is listening us.
Yes, doctor, yes.
Okay. Alright. So if any point if I'm unclear or you have any ambiguity or anything, you can always unmute yourself and tell. Okay.
Okay.
So I would just want you to go through the tetanus vaccination schedule once before you appear in the exam, because there are 5 doses and the last dose should be within the 10 years. If it is within the 10 years of like he got the vaccine 5 years ago, the booster one 5 years ago or 7 years ago, then it's fine. But if it is more than 10 years ago, or if he doesn't remember when was the last time he got his vaccination, then you need to check for his immune status or maybe give him just the booster dose. Okay, so in this scenario, we typically in such type of scenarios we don't have any DTs. Okay, we just try to find out what's the extent of the damage to the hand, and then we will just quickly check for the systemic review. We will just quickly ask about the main features of most of our main systems, you can say. Okay, any fevers, any neck rigidity, any shortness of breath, any cough, any fever recently, any lumps and bumps anywhere in the body, any weight loss recently. So just ask about the red flags maybe or the systemic review. Just one quick question about each system and then proceed. Then about the BMF. In this scenario, I always say that past medical history, medications, and allergies. This is something that you cannot miss in any of the consultation, because you need to know which medications the patient is on and which allergies the patient has, because ultimately you are going to prescribe him something and you need to know about the interactions and the allergies to prescribe the patient correct medicine. This is a part of acting as a safe doctor. So you cannot skip the past medical history, medications, and allergies, which you rightfully asked. And the most important in this one is occupation history or the effect of the symptoms on his life, because it was one day ago and he presented today. So what caused him present today? And you can also ask him about why didn't he came to the emergency yesterday? Was everything sorted out and was he okay with everything? Then why didn't he came to the emergency yesterday and came today? So that is also a part of asking his concern. Definitely something happened in the past 24 hours that provoked him to come to you now. So ask about it. Okay. The other part of the history, prima flosa, is really not important in this case. Okay. So you can just skip it if you are running short of time. So what we are going to do in the examination part, we need to check for the obviously check for the observations, and then had to do examination as I always say, to look for any other abrasions or grazes or any other scratch marks, as he have told you that he got a scratch as well on his feet. Regarding the specific examination for this scenario is, you need to check for the bite side, erythema, swelling, any restriction of movements of the fingers, and maybe you can also check for the neurological part in the hand. You can check for the sensations in the hand. Are they affected? Are you able to feel everything? So that is also important. Moreover, if the patient says that he's having fever or maybe there is some discharge as well, so this points that he has got some infection of the bite site as well. So in that case, there may be some positive lymph nodes, but that is covered in your GP, general physical examination. So which lymph nodes are more important in this case are the axillary lymph nodes and the neck lymph nodes. So you can mention them. If you are not going to exactly mention the general physical examination, you can just quickly mention, okay, I will also be checking the your lymph nodes in your axilla and your neck. Okay. Now coming to the diagnosis. Of course, there is no difficulty in telling him that this is a cat bite. Okay. But it seems from what you have told that it was a stray cat or a wild cat. Okay, so the stray and the wild cat, they usually live on the streets, and so their bite is at high chance of getting infected. And since you have presented late, more than 6 hours have passed since the bite, so it is a delayed presentation, and that is why it will demand some specific treatment with the antibiotics as well. So how are we going to manage? Of course, we are going to present the anesthesia, the first and the foremost thing, because that is the main concern of the patient. Okay, and maybe some people are confused at how to ask about ice in this scenario. Okay, so you cannot ask like, what is your idea of having this bite? Why did you have this bite? Of course, it's a foolish question. You cannot ask this. But what you can ask is that, do you think of anything that had aggravated this pain for last 1 day? Like you didn't have this much of pain when you had the bite, but you are having this pain now. So do you think of anything that could have aggravated this pain? Maybe they have done something. Maybe they have lifted their heavy objects at their work, and maybe that is the cause of their pain. Or it could be simply because of the cat bite that caused the local inflammatory reaction and it caused the pain. But nonetheless, to be on the safe side, you can ask about it. Okay. Then the concerns, they are always important in a consultation. Always ask about the concerns. Why are you here today? What brought you here today? What concerns you today? Okay. So maybe you can order the baseline investigations as well for the patient to find out if there is any change in the lymphocyte count or maybe white blood cell count. Okay. So give him the analgesia. That is the main requirement. Clean the wound yourself. Okay. We will be cleaning the wound ourselves and we will be cleaning it with the antiseptic to make sure that it does not get infected because it has high chance of infection. Okay, about the tetanus, I have already told you if it is more than 10 years since the last dose, then you need to repeat the dose. Okay, so here it is this wound has a high risk of getting infected. Okay, so what we need to do is we need to prescribe this patient with a prophylactic dose of antibiotic for at least 3 days. Okay, usually, we do not see very commonly that the prophylactic antibiotics are given unless if it's a contact case of meningitis or something similar. They usually do not prescribe any prophylactic antibiotics. But here we are going to give because it has high chance of getting an infection, and this is a hand which is the organ that is involved in our everyday activities, and since he has told you that it has affected his work, he couldn't go to work today. So maybe to avoid any further complications of it being infected and then he will be coming back to you and you need to drain everything, just prescribe the prophylactic dose of antibiotic for at least 3 days. And we will be seeing him back for after 3 days to see how the wound is and is there any discharge or any swelling or any erythema. And the safety netting will be the same. Any erythema, any excessive swelling that you feel that is restricting the movements of your fingers or your hand, or you are feeling that the wound is getting worse rather than getting better, then you need to come back right away. Okay. and then we will be offering leaflets maybe for the care of the wound and like how to keep it clean and avoid any kinds of infection. All right, so that was all about this scenario. I hope I made everything clear to you guys. Moreover, if regarding the safety netting, one thing we need to mention is if you get any fever or any pussy or any pus kind of discharge from this wound, you need to come back to us, and then we will be doing what we will be doing when he will come back. We will be assessing the wound. Maybe it needs drainage as well, and we will be prescribing a proper course of antibiotics then, because he can ask that why only 3 days of antibiotics, usually they are taken for 5 to 7 days, so can't I take for more? No, because prophylactic the dosage will be for 3 days, and then we will be checking for this wound if it's healed or if it's getting worse, and then we can decide accordingly if it needs a proper course of antibiotics or not. Okay, is it clear, Dr. Faiza?
Yes, doctor, it's very much clear. You thoroughly explain each and every point. It was very helpful.
Okay, that's really good to know. Okay, so
May I know, doctor, sorry,
yeah, sure.
may I know how will you score me in this scenario?
To be honest, I would pass you in this scenario because you asked all of the major things. Just
Okay,
one thing that I feel
all
that
right.
if you would have asked me about my concern, that why am I here
Yeah,
today, that I always emphasize on, then I would
yeah,
definitely have marked you about 10. Okay,
yeah.
but
I think I have asked, but I have asked very later.
yeah,
Yeah,
I had already told you in the conversation
yeah,
later that
yeah,
yeah, I'm
yeah,
here because of
exactly,
my pain. Yes, yes.
exactly.
So just after
Okay,
asking about the event, try to ask what brought you here after 24 hours.
all right. Okay. Thank you,
Okay,
doctor.
so
Okay.
otherwise it was very good performance because you asked all the relevant points in the history. The time management was a bit
Okay.
like it wasn't very much good, but I hope you will do it in the exam.
All
So
right. Okay,
yeah,
doctor.
you need to
Thank you.
work
Thank you
on
so much.
time management and the concerns part. Yes, you asked a bit later, but try to ask in the beginning as
Yes,
well.
earlier. Okay. Thank
Okay,
you so much, doctor.
but
Thank you.
I'm sure that you are passed in this scenario.
Okay. Thank you
Be
so much,
sure of
doctor.
that.
Thank you.
Okay.
Okay, doctor.
Okay, Dr. Anuna. Actually, rabies is not there in UK or the developed countries. It's basically in the rabies is present in our home countries. So that is why we start all the treatment and vaccination for the rabies, but they won't ask you about the rabies because it's not there in the UK. Their animals are vaccinated and well protected, and that is why there is no chance of transmission or um, rabies is not there. Okay, so they are not really worried about the rabies. You're welcome. All right, so Dr. Hera, are you here? Dr. Hera, we are going to talk about your performance now. So you can unmute yourself if you want to. Otherwise, it's fine. I will be explaining everything. Okay. So coming to your scenario, I must say you did a very good thing and very good performance in your history taking. You asked all the relevant questions, and what made me very much happy about your performance was you asked the relevant part of PMFDOSA. That was really good of a thing in both the candidates, Dr. Faiza and Dr. Hira. You both asked the relevant questions in the PMFDOSA, and that is the basic trick to save your time in the history take. If you master this trick of asking only the relevant part of the PMFTOSA, then and only then you are going to manage time and you are going to have time for management. I must say, Dr. Era, it was a long scenario. Obviously, the chest pain scenarios are long, and you need to manage time accordingly because you were not able to manage in 8 minutes the case. Although we had some problems with showing you the findings, um, and I added that 30 seconds as well in your consultation, but still, uh, a bit of work on the time management will definitely go a long way, and you will definitely be get benefited from this. One thing I always say about any kind of pain scenario is asking about the Socrates, full of the Socrates. You, to be honest, you in 80% of the pain scenarios, you get your diagnosis while asking the Socrates question. So you don't need to like go here and there in the history, in the other parts of the history. If you have got your diagnosis in the Socrates, you will only ask about the relevant part of the Tumaftosa, and that is how you are going to save your time. And believe me, any academy, any teacher, anywhere you go, they will always emphasize that always ask full-fledged all of the questions of Socrates and Odipara wherever relevant. Okay, so although I told you a lot of things while I was explaining my episodes to you, so that your time is saved and you get a lot of the details from that, but still you could have asked me that anything that could have aggravated this problem, anything you feel that has relieved this problem. Although I told you that yes, I sat down and it got relieved, and definitely walking uphill and then lifting some heavy objects. Okay, so that is what I want to say, that always ask about. You didn't ask about what was a major mistake you did in your Socrates. You didn't ask about the side of the chest pain, and that is where you sound a bit scripted, because you didn't ask me where's which side of the chest. I didn't tell you that it's on my left side, but you still asked me, okay, does it go to your arm and your jaw? You never know if it's on my right side, and maybe it's some kind of traumatic pain, that I had a trauma 2 days back, and then I was walking uphill and that muscle was pulled while walking uphill, and then I got the pain. Maybe this could be a reason. Maybe I have came back from like some air travel 3 days back, and then I was traveling uphill and I got this pulmonary embolism, and I got this pain. Maybe I was having fever for past 2 weeks ago, and now I got this pain, which I got while walking uphill, and maybe it is relieved while bending forward. So what is it? It could be pruritic chest pain, pericarditis. Yeah. So what is the main thing to ask in a pain scenario is which side is it? Be it chest, be it eyes, hands, anywhere. Ask about the side. Can you exactly point where exactly is the pain? This is the best question you can ask. You will get a lot of answers in it. You will straight away point here, okay, it is here, but sometimes it goes there. Maybe you don't even need to ask about the radiation. He will tell you yourself that yes, doctor, I get on this left side, but it sometimes goes to my arm. Okay, so I'll always ask, the first question is how did it happen? When did it happen, and where exactly is it? Which side is it? Okay, then all the same aggravating or relieving factors. Maybe he told you that the rest relieved his pain, but you could have asked maybe any medication that you have taken for this pain yourself, or your wife maybe have had given to you. Okay, then you were not very clear about asking about any of the symptoms, and I didn't bother wasting your time there. And I told you myself that no, I don't have any fever or any. I don't remember what exactly you asked, but I told you that yeah, you asked about the cough. Maybe you were trying to rule out pneumonia. but sweating was more important than asking about the cough in this scenario. Okay, first try to ask about the other symptoms of a heart attack or a coronary event, and then move to the disease. So yes, you got a bit of idea from my history that yes, when I rest, I'm getting relieved of this pain. So yeah, you got a bit in your mind. Yeah, this could be a stable angina. Okay, then just quickly ask about the other disease about unstable angina. Okay, do you believe that while after taking rest and when you got back to your work, it started again? And maybe sometimes during few episodes you believe that it wasn't relieved while you sat down as well. Okay, then pericarditis, heart failure, shortness of breath, fever, cough, pneumonia. Okay, so ask about all of the DDs. At least 3 or 4 of the DDs question you need to ask. Do not sound scripted, because yes, we all try to memorize these scenarios and practice again and again with people, that we tend to remember these things, and we are at some point we know of a few of the scenarios, that yes, when we read the scenario we know, yeah, exactly, I know what is it. But still you need to show them that you don't know the scenarios. They shouldn't get any hint that yes, you have performed this back in your academies or with anyone else. Okay, so you need to rule out every other possibility that is, you can say, a serious condition, a serious heart condition that can worsen if you are not keeping that in mind. They are testing you for their patients. That if you are in their hospitals, how are you going to act as a safe doctor? And they are really looking for a safe doctor. Whenever you rule out all the major red flags of a particular symptom, only then they are happy to go. When you ask about their patient's concerns and rule out all the red flags, only there then, yeah, mostly you pass that scenario. Of course, the management and history taking points are all important, but I'm telling what they are trying to find in a safe doctor. Okay, so about the PMF dosa, I have highlighted the main points in this scenario, in the heart coronary scenarios, that are most important to ask in this, that you cannot miss. Of course, past medical history, medications, and allergies. I would say again and again that always, always ask. Apart from these, in the chest pain scenarios, you need to ask about the family history. It can always point to something. Okay. Then about the lifestyle or the DASA, which Dr. Mira definitely asked me, and I'm really happy that she asked about everything in the DASA part. Then, of course, about the occupation, because if he is having the stable angina, and if he is working as maybe laborer or anyone who is having this activity at the work, that he needs to lift heavy objects, or he needs to go uphill and downhill or upstairs or downstairs, then definitely he's going to get attacks again and again. And then we need to involve the occupational health care team, because they are going to assign him a different job according to the suitability of his health, and maybe he won't continue with this job because that is affecting his health. So yes, in chest pain scenarios you need to ask about the occupation as well, and the travel history is also important. Okay, then again about the eyes, saying that again and again, ask about the idea which Dr. Hira also asked me, and concerns. I'm very happy that Dr. Hira asked me again and again about my concerns, my wife concerns. Why did your wife force you to come here? if you think everything is fine. What concerns you or your wife about this? I'm really happy about this. She asked me again and again about my wife's concern, my concern. So yeah, that was good. History taking was definitely on point for Dr. Okay, then effect of the symptoms. Of course, if she definitely asked me, but yeah, the patient would be very casual about this pain because it is getting relieved on its own, so he won't be very much affected by it. This, however, if he had an episode at his work, then definitely he's going to point out, yes, it is affecting my work because I cannot work because of this pain. So definitely you need to ask about effect of symptoms, as it is active for past 1 month. So there could be something that is being affected by this pain. Regarding the examination, you need to check for all of the vitals. And to be honest, to save your time, just mention that I will be checking your observations, and just mention the most important one that you would be checking in this scenario. That is your blood pressure and oxygen saturation. That is the most important that we need to know in the hard scenarios. Maybe if he's pointing a bit about towards because usually they give you findings of all the observations which you mentioned them, but still some people feel that I need to mention blood pressure, temperature, pulse rate, respiratory. It is going to take 30 seconds of your time, so it is of no use. Just mention I will be doing your observations. That will include your blood pressure and other parameters, because blood pressure is very important in this scenario. He told you that he was diagnosed as hypertensive and he quit his medications. So you need to check for his blood pressure. Then you then obviously mention about the head to toe examination and chest CVS examination. Always mention heart tracing in the chest pain scenarios in your examination part, because it's a bedside examination, and you can get the result there and then. I know a person who failed a scenario of chest pain because he couldn't mention ECG, and that is why they did give him the finding of ECG, and he missed the scenario and he failed it. So always try to keep ECG in your mind whenever you see a patient with chest pain. Regarding the diagnosis, Dr. Hira, I would recommend that try to use smaller phrases and that have definitely deeper meanings, and they explain everything in a situation. Because you took a good 1 minute in only explaining me what stable angina is. So what could be the only explanation in this case was it is a chest pain that we get due to reduced blood supply or oxygen supply to our heart muscles. There is a temporary, maybe this could be due to temporary blockage in one of your arteries to your heart, and we need to find out the cause by further specialist investigations, which I'm going to tell you later. So this is the simplest definition that you can tell him, and he would understand. You don't need to explain everything that yes, because of your um, uh, blood supply and everything, and you took really some time in explaining all of this. What I admire in your explanation is you mentioned the risk factors he had. So yes, mention the diagnosis and then mention the risk factors, that as you are overweight, you enjoy having fast foods, you do smoke, you do not exercise, you were diagnosed with high blood pressure, and you are not taking your medication without knowing what exactly is your blood pressure. So these are all the risk factors in your case that could point towards this pain as a cardiac pain. These are all the positive things that are causing me to suspect that this could be a heart attack, uh, not a heart attack, but could be a cardiac event. And then the family history. You also need to reinforce yourself by saying that since your father also had a similar episode, and I'm really sorry to hear about your father. You didn't say anything to the death of my father. You need to say sorry if you hear anyone died or anyone is struggling with a disease in the patient's family. Always empathize there. Okay, so it was a major risk factor as well, the family history that the father had died of a heart attack. Okay, coming to the management. So I gave you a bit of extra time to just quickly mention the management. And to be honest, you do not get more than 2.5 minutes of for management in the GMC as well, because there is a lot to ask in the chest pain scenarios. So try to make a flow chart, maybe, or maybe some points that how are you going to tackle the important things in the beginning and then the test advice at the end. You were what I saw was you were a bit haphazard in your management. In one sentence you were saying yes, I'm going to prescribe you medications. In the other sentence you were discussing my smoking and my diet habits. So how to tackle this situation effectively? So there is a way of dealing with such situations in which there are a lot of things that need to be addressed and you are running short of time. So what you are going to do is you will say that Mr. Tom, I'm suspecting that this pain is coming from your heart, and there are few things that we can do to manage this pain, and there are few things that you can do yourself to help you with this pain. So, what would you like to hear about first? Would you like to know what I am going to do for you, or would you like to know how you can change your life? This will not only increase your IPS marks, but the examiner will also get this notion that definitely this candidate knows everything. And even if you run short of time, and if even if the bell rings before you complete everything, he knows that this candidate knew all of this. Okay, so whenever a station has a lot of things to say, the management try to use this kind of mechanism. That mentioned, there are one, two, three things that I need to discuss today. So, what would you like to hear first? And they will tell you, okay, doctor, tell me what you are going to do. Okay. So, what I'm going to do is I will be running all of your baseline investigations to see that every other thing is going fine. I will be doing your cholesterol levels as well, because that is one of the predisposing factors to the heart disease as well. Okay, so just a few more things, and then we will end this meeting. So yes, regarding the management, what we are going to do is we are going to run all the baseline investigations, including the heart markers. Very important, you need to mention heart markers here because in NSTEMI, the ECG will be normal. But what will differentiate the NSTEMI from STEMI is that the heart markers will be raised. So if they want you to go towards that side, maybe they can provide you with the result of the heart markers in the consultation when you mention them. So always mention heart markers in a heart scenario. Okay. Then regarding the referral to the cardiologist, yes, we do need to refer the patient to the cardiologist, but it will be a routine referral since the patient does not have any pain, any active symptoms right now. So it will be a routine referral to find out the cause of this stable angina. What is causing this? So what the specialist will be doing, he will be doing some specialist scans which include echocardiography and maybe your coronary angiography to see if any of your vessels are having any block. So just mention this as these are really important things. Okay, regarding the medications. Doctor, you were going to give me about the aspirin, and then you said, okay, no, I'm not going to give you because you're allergic. No, I was not allergic to aspirin. I told you I'm allergic to penicillin. Okay, so I know that this could happen in the consultation that sometimes we do misunderstand things and we do say such things, but try to avoid these things. Okay, so
Okay.
you can safely give aspirin in this case. Okay. But I really appreciate that you mentioned that I'm going to give the blood thinners. All right, then coming to your blood pressure part management. As the patient was diagnosed hypertensive and he is not taking his medication, right? So even if the
Yes.
patient BP is 144 by 80, which is a bit of borderline, okay? But you need to give the patient
Yes.
antihypertensive, which is the ACE inhibitors that have a cardioprotective role as well for his angina,
Mm-hmm.
okay? So you were not wrong in saying that, but I was just trying to take this out from you that why do you want me to take the antihypertensive medications? Then you had to mention this. Then since you were diagnosed with the hypertension and we are not aware that you are having any readings at your home, maybe they were high. He does not have any ambulatory BP readings. So if you don't want to prescribe any antihypertensive right now, you can mention that. How about if we start with ambulatory BP readings again? Because your BP is on the borderline and it could trigger your heart event as well. So we need to be sure that everything is going fine with your blood pressure. Okay, then we will be telling him that we are starting on some heart cardioprotective medication that protect the heart from any significant event until you get your appointment with the cardiologist. So in the heart scenarios, try to give the patient aspirin, atorvastatin, ACE inhibitors, and beta blockers have cardioprotective roles, so we should prescribe them. Also, if the patient has a history of hypertension, so they will control the blood pressure and also have protective effect on the heart to prevent any such incident in the future. Then about the GTN spray. That is the main aim of this consultation to make the patient understand about the GTN spray. You said the right, I think that you are going to spray it under your tongue or in your mouth. Okay. So what you are going to safety net about is that if you get this pain and you use this spray, wait for 5 minutes. If the pain is unimproved, you take the spray again. Wait for another 5 minutes. If the pain is still unimproved, then you take another spray and call the ambulance right away. Call 999. The third spray At the third spray, you need to call the ambulance because the ambulance is going to take some time and you don't need to check that if the third spray is working or not. Just call the ambulance. Then comes the test advice. However, there are scenarios in which the patient would say, okay, tell me, doctor, what I can do for myself. Only then you are going to bring the test advice in the start. Otherwise, tell them what you are going to do for them or just ask them, what do you want to know first? What we are going to do or what you can do for yourself.
Mm-hmm.
Okay, then you can mention
Okay.
all the diet advices, exercise advices, and smoking advices. That is definitely a long thing, and if you go in the details of DESA advice in the beginning, then you are definitely going to miss the management, the medications and the referrals and the investigations part that are more important in this case. Okay, so just try to
Okay.
prioritize the management part, that what is more important to mention here Of course, DESA advice, I'm not saying that it's not important. It is a very important thing that he needs to change, but it comes later in the consultation.
Okay.
Okay. Then about the safety net, tell the same GTN spray, and if the chest pain is unimproved after your medications, and if you feel that you're having a prolonged attack of this chest pain, then you need to call the ambulance right away, and then offer the leaflets. Leaflets always save you from if the time runs out and you are not able to say everything. Even if your DESA advice
Okay.
has wasn't able to be addressed in the consultation, just mention, okay, I'm going to give you some reading material on your on this lifestyle habits that people usually have and that cause these heart events. So how about if you give a read about them, and you can see that you are smoking and you are having some unhealthy diet and you are not exercising as well, so maybe you can find some useful tips in this leaflet. So that is how you are going to save your marks and your time as well.
Okay.
Okay. So otherwise, it was a
Okay.
wonderful performance. Just you needed to manage your time in the management part. That I'm hopeful that I was clear to make you understand what exactly happened and what was wrong with the management. I hope you will
Yes,
perform
you are
well.
right. Yeah, I appreciate your feedback, and I hope that I will perform it I mean in good way next time.
Yes, sure.
I really
You will
appreciate.
do definitely great things because I can see that your history is very strong history, and I really appreciate that. But try to work a bit more on your time management and your management skills. Okay? Because
Okay.
they carry
All right.
equal marks as well. So I really like
Mm-hmm.
your IPS as well. You asked me about my concerns and you definitely addressed everything here and then. And your history taking is very strong. I really like it, but try to have some time for the management as well. Okay?
Okay. Thank you.
No worries, you're welcome. Okay, Dr. Niza, no, we don't need to admit this patient. We only admit the patient with chest pain when he is actually having a chest pain right there and then. If he is symptom free right here, then we don't need to admit. We will be just ordering the baseline investigation and arranging a follow up maybe in 2 weeks' time to see to discuss the test results. And a routine referral to the cardiologist would be enough. Okay. So we are also conducting paid one-to-one mocks, mini mocks, and partner mocks. And I usually share details in the message. Just give me a message, and I will share all the details. I try to give feedback on the GMC pattern so that you can get maximum benefit out of it. So just try to just give me a message on my number, and I will share the details. Um, all the best, everyone, and I'm really happy that the candidates who performed today they did really well. I hope that you all learned from today's session, and I would highly appreciate if you can provide your feedback to us as well. Okay. Any other questions from any other candidate who wants to ask? All right. All the best, guys, and see you next week.